Hi, Mr. Ferguson. My name is Nancy. I'll be your provider today. And just to let you know that everything here is confidential, so no one else will know anything that's said in this room. So what brings you in today to the clinic?
I've been having a cough and congested.
Okay. And when did this start?
Like 3 days ago.
Okay. And how would you describe the cough? Is it, would you say it's wet or dry, or what would your description be?
It's pretty wet because I'm congested and it's a lot of mucus.
Okay. Would you say it's worse during the day or night or about the same?
During the day.
Okay. Is there anything that helps it or aggravates it more?
No.
Are there any other symptoms that you're having with the cough?
I've been having diarrhea. My stomach's been hurting too.
Okay. And you said you're having some congestion
Yeah.
too? And are you taking any over-the-counter medicine for it?
Just Sudafed.
And do you know what dose it is? Is it just the regular over-the-counter? And how often are you taking that?
Once or twice a day.
Do you take any prescription medicine?
I just have Sopanex for my breathing machine.
Okay.
And that hasn't been really helping.
Okay. And how many times a day have you been using that?
I've only used it probably a couple times, once a day.
So since the cough started, you've used it
twice.
A couple of times. Do you take any vitamins or herbal supplements?
No.
Are you allergic to any medication?
No.
Any food allergies?
No.
Environmental allergies?
No.
What about latex allergies?
No.
And what method of contraception do you use?
I'm not sexually active right now.
And what about when you are?
A condom.
Okay. And then what about your immunizations? Probably from when you were a child, but I just need to ask you about that. Your measles, mumps, and rubella vaccine, I just need to know like the approximate dates of when you had those. The measles, mumps, rubella, pertussis, polio, hepatitis A and B. Do you remember or do you know the dates? Just when you were like a kid, probably?
Yeah, I don't remember. Probably when I was a little kid. Yeah.
Okay. What about the varicella, meningitis?
Yeah, meningitis.
And the smallpox and the HPV, do you know if you had those?
I don't know.
Okay. Do you know the date of your last tetanus shot?
Probably a year ago.
Have you ever had a TB skin test? Do you know?
No.
And do you know if you've had a pneumonia vaccine?
No.
And have you had your flu vaccine this year?
Yes.
And do you know approximately when that was?
About 6 months ago.
Okay. And when was your last well check, like your last physical exam?
About 8 months ago.
Okay. And what about your past medical history? Would you say, I know you said you have asthma. Other than that, would you say you're generally healthy, or do you have any other medical history that we would need to know about?
No.
And what about mental health? Any history of depression, suicide, anything like that? What about childhood illnesses? Any history of measles, mumps, rubella,
No.
the whooping cough, chickenpox,
No.
rheumatic fever, diphtheria, polio? I know you said asthma. Is that the only thing? Is the asthma?
Yeah, it's the only thing.
Okay. What about adult illnesses like cancer, hypertension, any trouble with diabetes?
No.
Sexually transmitted diseases, hepatitis,
No.
tuberculosis, heart disease.
Mm-mm.
Okay.
No.
Any hospitalizations?
I had surgery on my ear, tubes when I was little.
Okay.
That's about it.
Okay. Was that when you were like a baby?
Mm-hmm.
Okay. Any trauma or injuries, like a car accidents or broken bones or anything like that?
No.
Any disabilities?
I have a moderate hearing loss in my right ear.
Okay. Do you wear a hearing aid for that?
Yes.
Okay. Any history of blood transfusions?
No.
And then what about, I'm going to ask you about your family history, so like your parents, grandparents, siblings. Any history with your mother? Any kind of history of like high blood pressure, cancer, anything like that?
No.
What about any significant history with your father?
He has Crohn's disease.
Okay. Anything else? Any diabetes, high blood pressure, cancer with your father? No?
No.
And are both your mother and father still alive?
Yes.
Okay, and what are their ages?
Mother 47.
Okay.
Father's 48.
Okay, and what about, do you have brothers and sisters?
Yes.
Okay, and what are their ages?
Okay, I'm 17. My littlest brother is almost 10.
Okay.
My other little brother is 15.
Okay.
And my older sister is 19.
Okay. Any health problems with any of them? Asthma, diabetes, cancer, anything like that?
No.
Okay, and what about your mother's grandmother? Any kind of cancer, diabetes, high blood pressure?
She has high blood pressure.
Okay. And is she still living?
Yes.
Okay, and what about your mother's father?
He had cancer.
Okay, and is he still alive?
No.
Okay, do you know approximate age of when he passed away?
65.
Okay, and what about your father's father?
He has high blood pressure as well.
Okay, is he still alive?
Yes.
Okay, and what about your father's mother?
She's had breast cancer.
And is she still alive?
Yes.
Okay. Any other medical history you can think of in your family that we need to know about? No, so no diabetes, anything like that?
No.
Okay. And then what about your social history? Any smoking?
No.
What about any alcohol use?
No.
Drug use?
No.
Okay, and what is your occupation?
I'm a student. I go to college. I'm in college.
Okay. Any kind of history of exposure to any kind of toxins in your life that you can think of, like lead, asbestos, any kind of radiation, anything like that?
No.
Okay, what about any travel to foreign countries in the last couple of months? We might have been exposed to anything?
No.
And what do you have any hobbies?
Yeah. I like cars.
Okay. What do you like to do? Just like work on your cars?
Yeah, I like learning about them.
Okay. What kind of car do you have?
Infinity.
All right, and then have you noticed, just kind of generally about you, have you noticed any kind of increase or decrease in your appetite recently?
No.
Okay. Any change, significant change in your weight?
No.
And then approximate how much caffeine do you drink per day, like cups of coffee or sodas or tea or anything like that?
I have a cup of coffee in the morning and maybe a couple sodas.
Okay, so maybe like 3?
Yeah.
Okay. Okay, and then have you noticed any, with your skin, hair, nails, have you noticed like any rashes or itching or anything significant with your hair, nails, anything like that?
No.
Anything that you can think of?
No.
Okay, what about any increase in sweating? Anything like that?
Mm-mm.
Okay. Any headaches, dizziness, loss of consciousness, concussions, anything like that?
No.
Okay. Any blurred vision or light sensitivity?
No.
Do you wear glasses or contacts?
No.
Okay. And you already said you have a hearing loss. And which year did you say it was?
My right ear.
Okay. And you said that with the cough, you said you've been spitting up some phlegm.
Yeah.
Has it been a color or has it been clear?
Mostly clear, some yellow.
Okay. And how much would you say you've been spitting up? Has it been a lot or a little? Is it every time you cough?
No. Just a little.
Okay. Have you been spitting up any blood?
No.
Okay. Has it been painful when you cough?
No.
Okay.
If anything, it kind of relieves it.
Okay.
The congestion.
Okay. And have you said it's been, have you noticed, I know you said you've been using your breathing treatments. Have you noticed any wheezing
No.
when you've been coughing, or do you just think that the breathing treatments might help the cough? Or do you feel like you've been wheezing?
No, I haven't been wheezing.
Okay. Have you noticed any issues with your ears, any ringing in your ears?
No.
Or change in hearing?
No.
Anything like that? Have you noticed any drainage from your nose?
Yeah.
Congested.
Runny
Okay.
nose. Yeah.
Any sinus pain? Like here, pain or pressure?
No.
Okay, what about in your throat? Has your throat been sore? Voice been hoarse or anything like that?
No.
Okay. Do you have any heart issues? Any high blood pressure? Have you had any chest pain or anything like that?
No.
Okay. What about difficulty with exercise? Any like, do you get real short of breath when you exercise or anything like that?
No.
So you said you've had a little bit of diarrhea recently too?
Mm-hmm.
Okay. Other than that, since you've been sick, have you had any blood? Have you noticed any blood in the diarrhea or anything like that?
No.
Have you had a change in your appetite recently?
No.
Okay. Any nausea or vomiting?
A little bit of nausea.
Okay. Any trouble swallowing?
No.
Okay. Any trouble urinating? Has it been hurting or burning?
No.
Or noticed any blood in your urine?
No.
Okay. Any trouble, and no sexually transmitted diseases or anything like that?
No.
And approximately what age did you go through puberty?
Probably like started at 14.
Okay. And any testicular pain?
No.
Okay. What about any muscle pain, weakness, joint pain?
No.
Okay. Any joint stiffness?
No.
Okay. Any sudden weakness or dizziness?
No.
Any seizures or problems with coordination?
No.
Okay, have you noticed any of your lymph nodes been swollen, like under here, anything like that?
No.
Okay. Have you noticed any abnormal bruising anywhere or bleeding?
No.
Okay. And you said no unexplained weight change.
No.
Any increased in thirst, hunger, or increased urination?
No.
Okay. Any trouble sleeping?
No.
Suicidal thoughts or depression?
No.
Okay. All right. I think that's about it. And all right, I appreciate it.
Thank you.